Welcome, friends. I'm Jared, and if you're interested in the topic of sleep disorder breathing or not, stay tuned to this video because if you're like me, you're interested in staying youthful looking and healthy, and you feel bad when you see people who are suffering with one doctor's visit after another. By taking action when early warning signs show up, much suffering could be prevented. However, the course that's often being recommended to us is just to accommodate the root problems by covering up the signs and then forgetting about it. In this video, I'm going to be focusing on just one example of this, and so I'll be talking about sleep disorder breathing. First thing I wanted to say is I'm not a medical professional, I'm not a doctor, so why am I bothering to talk about this? Well, that's a good question. Why don't I just leave it in the hands of medical professionals to talk about this? Well, medical professionals seem to be too afraid of losing their accreditation to speak about these topics in a straightforward way. I had a medical professional tell me directly one time, we have to be very careful how we answer that question because we don't want to lose our accreditation, and I'll get into that during this video. Also, we'll talk about a ridiculous disclaimer that the American Association of Dental Sleep Medicine is required to put on their website. I don't see how anyone who was actually practicing sleep medicine would be allowed to call this out, although some of them would probably really like to. So disclaimer, I'm not a doctor. I don't practice sleep medicine. I'm not affiliated with it in any way. I'm not approved by the American Medical Association or the American Dental Association. So I'm going to call this stuff out if I want to. So to start off, when we're talking about sleep disorder breathing, it's not a yes or no question. It's not a do I have sleep apnea or not. It's actually an entire spectrum of severity, starting with upper airway resistance syndrome, which is the least severe. As the condition continues to get worse, it progresses to mild obstructive sleep apnea. The next level is moderate obstructive sleep apnea. And finally, there's severe obstructive sleep apnea. So I'm going to be talking about how the earlier we catch this problem in this process and do something about it, the better. Unfortunately, sometimes the problem isn't caught until it's in its most severe form. So I'm going to be talking about how the process of taking action in this regard seems unnecessarily convoluted. And so this may be why the problem doesn't get caught until later on, and that's a shame, really. So let's get into it. If you're not familiar with healthy sleep, it might seem like I'm bouncing from topic to topic because I'm going to be talking about ear, nose, and throat. I'm going to be talking about dentist. These are topics that actually have a lot to do with healthy sleep, so just be patient and I'll try to tie them together. So that's my warning before I jump into ear, nose, and throat. So if you can't breathe through your nose, it will adversely affect the quality of your sleep. In fact, even if someone's using a CPAP to help them sleep better, if they can't breathe through their nose, it will drastically reduce the effectiveness of the CPAP. So I want to mention something that an ear, nose, and throat doctor told me one time. And it's true that this is just something that one doctor said one time, and he probably didn't even think too deeply about it before he said it. I don't think it's unfair to conclude that there is a strategy being promoted that we just wait until problems get more serious before we take corrective action. And this quote simply shows how illogical that strategy is. So the doctor told Beth and myself, he said, just by looking at you, I can tell that neither one of you have sleep apnea. Now, I'm not going to disagree with his statement. I am going to disagree with the logical conclusion that he was trying to get us to reach based on that statement. He was essentially saying, you don't have sleep apnea, so don't be concerned about it. Don't worry about it. And that's such a backwards way of looking at it. That's actually another way of saying that we should wait until we have visible signs of deteriorating health before we do something about it. See, so apparently we still had a healthy, youthful glow about us since he could tell just by looking at us that we didn't have sleep apnea. So why wouldn't we want to do something to make sure that we keep that healthy, youthful glow? I think I speak for a lot of us. We would like to stay youthful as long as we could, wouldn't we? I have nothing against this doctor, though. He's a good, skilled, nice doctor, but it just seems to be the culture of the system. Another thing that really showed that the system is set up to encourage us to just wait until the problem gets worse is that your health insurance will not cover any treatments for this unless you actually have the disorder of sleep apnea present. Your insurance isn't going to cover this if you only have upper airway resistance syndrome. Now, even in my case, I originally thought that this was such a big deal to try to get the insurance to cover everything. But now that I see how things really work, I realize that I shouldn't have been concerned about that. The reason being that my deductible was $1,500 and the treatment ended up costing me $1,500. So looking back, I just don't see it as wise to get hung up on whether it's covered by insurance or not, and especially in view of what comes next. Upper airway resistance syndrome, or UARS, can have symptoms such as fatigue, depression, anxiety, weight gain, high blood pressure, and these things can start you down a vicious cycle. For instance, if you gain weight because of UARS, it's going to make the condition get worse and move the needle more in the direction of sleep apnea. So now by the time you've allowed the condition to progress to the point of sleep apnea, you not only have to address the sleep apnea, but you have to lose weight and you have to get your blood pressure under control maybe. And you may have to accomplish all of this while being depressed. So I don't know if you've ever heard of the expression too busy putting out fires, but it was an expression that I heard a lot working in manufacturing. But honestly, I think it's more applicable in this than in manufacturing. It may be, but by the time we develop all these health problems, that they seem to pose more of an immediate danger, and therefore they take a higher priority. Then treating the sleeping problem takes a back seat. Another reason why I don't think it's a good idea to wait on this problem to get serious to do something about it is just because CPAPs are annoying. About half of people who get CPAPs stop using them because they just can't tolerate them. If we do something about it earlier, we can likely avoid ever having to use a CPAP. Another reason why we might want to take action right away is because this problem has multiple facets. If someone is diagnosed with sleep apnea, and they also can't breathe through their nose, then a CPAP is only going to have limited effectiveness. But getting a septoplasty in addition to the whole CPAP ordeal might seem overwhelming to do all at once, especially since the person is already lacking energy because of sleep apnea. If the problem was caught earlier, then taking the necessary steps would seem much more manageable. I would also be remiss if I didn't mention another danger of waiting until the problem gets more serious. And this is something that a doctor told me that makes a lot of sense, actually. He talked about people getting married to their disorders. He talked about when he tries to get to the root of the problem with some patients, they shut down and they aren't willing to cooperate. Well, unfortunately, getting to the root of the problem is sometimes tantamount to accepting that if we address the problem sooner, it would never have progressed to the point that it's at. And when I get to how convoluted the established system is making things, you'll see that it doesn't really make any sense to have shame about this. But still, it's a real danger that shame could cause you to marry your disorder because it stops you from actually confronting what the root problem really is. So I really don't see how it makes any sense to take your chances and put off addressing sleep disorder breathing, whether it's advanced to the point of sleep apnea yet or not. But listen to this. I went to a dentist and the dentist noticed that I was grinding my teeth, and he recommended that I have a mouth guard made. Now, this is really the same as advising me not to do anything about a problem that's just going to continue to get worse if it's not addressed, causing my health to deteriorate. And that's because if someone grinds their teeth, they likely have UARS. It's one of those early warning signs. And instead of putting a mouth guard in my mouth, I could have an oral appliance made that not only protects my teeth, but also improves my sleep. And it can prevent complications like high blood pressure, irritability, weight gain, and others. So to me, if I'm going to take the effort of keeping something sanitized and putting it in my mouth every night before I fall asleep, I'm going to want it to do all of the above, not just protect my teeth. And especially since mandibular advancement devices, although they're more expensive, they're actually more durable, so they last longer. So I don't know that the expense is really that much of a difference either. So I told my dentist no thank you, and I had another device made by another dentist called a mandibular advancement device. And this is a device that you put in your mouth, and it not only protects your teeth, but it also holds your jaw in a position that you can breathe better while you're sleeping. So by not even letting me know that the mandibular advancement device was an option, he was really discouraging me from addressing the problem of UARS. So because of how long this video was getting to be, I decided to break it up into several parts. Now, I did say that in this video I was going to be talking about a disclaimer that was on the aadsm.org website, and I didn't get to that part of the video. So what I'm going to do, I'm just going to show what that disclaimer is right now on the screen, and then I'll open it up to the comments section. Let us know, why do you think that the American Academy of Dental Sleep Medicine is required to put this disclaimer on their website? Maybe you know the answer. Leave it in the comments. And if you're interested in health and wellness content, subscribe to our channel. I'll be releasing the remaining videos in the next few weeks, so if you're subscribed, you'll get a notification for those. And leave a thumbs up on this video. Beth and I really appreciate all the support, any of the above, and I'll see you in our next video.